It's a pleasure catching up with you. Ramesh is the CFO of Lupin Pharmaceuticals, and what fascinated me, and I saw Ramesh speaking at a session, and what fascinated me was his description of what reporting is all about. Ramesh, do you just want to tell us what reporting actually means?
In my mind, reporting is all about actually capturing the qualitative assumptions that go into any business and turning it into a quantifiable challenge. You don't actually get to the outcome of it itself, but you actually look at various elements of the qualitative aspects and then say these could be quantified. You leave it to the user of the various inputs to actually turn it into a quantifiable challenge. For example, I could give you the various aspects of, say, the brand valuation instead. But the actual brand value, because there are various, again, issues, vulnerabilities associated in terms of discounting factor, and probability rates associated, etc. You might like to draw your own conclusions from that. But to my mind, entire corporate reporting has to take into account your external factors, your internal factors, the use of your resources, and the environment in which you operate. It could include the economical aspects of it, the world, Indian as well as the global scenario, and a host of other factors which generally impact on business.
So, in the context of the pharmaceutical industry, how would you capture the qualitative and put it to the quantitative? Do you have an example of that?
I will tell you this. For example, I'm in the business of generics, and of course, if you talk about the ethical pharmaceutical business, there is a patent life associated with any medicine. It ranges from 7 years, 20 years.
Yes.
Actually, 20 years. The actual usable life is much lower than that, depending on when you actually got patents. So essentially, you need to capture this. That's one qualitative aspect. So essentially, post this, what would be the scenario? So obviously, there's going to be a price erosion. In the meantime, you could also be talking about various innovative measures that we are taking to actually sustain that life, in terms of further innovation and so on. So I give a lot of these qualitative aspects, and there could be some aspects of the quantitative issues revolving around it, which could also be captured there. But the end outcome is essentially value, which could be attributed to that particular issue coming through. I won't obviously specify that. The entire reporting system has to capture this aspect of the patent life and the various uncertainties associated with it, but not the final outcome itself.
So you're basically saying then, if I were to re-articulate what you're saying, that this drug is going to go into the generic phase in 15 years from now, right?
Correct.
And when that happens, the valuation of this drug is going to be, there's going to be a price erosion as a result of it, the cash flow coming in is going to decline, and I have to capture that today, because that's how I bring the qualitative into the
15 years could be pretty long, essentially, but there could be a host of other factors, demographics, the way disease patterns evolve, so a host of other factors. So it's very difficult to conjecture into the very long term, but you could certainly employ this for the next 3 to 4 years. Medium-term planning is what I would actually advocate. Very long-term planning, obviously, for different purposes whatsoever. If we're talking about newer drugs and so on, I could also, for example, conjecture that biosimilars, bio would be the way to go, because small molecules are getting away, and there are newer molecules which are possible in biotechnology. And science is something which keeps evolving.
And this is dominantly going to be in the balance sheet side rather than the P&L side.
It's absolutely on the balance sheet side. Absolutely. It's a qualitative aspect which obviously impact on future cash flows, which will impact obviously on the
Wonderful. Thanks a ton, Ramesh. Always a pleasure. Cheers.